We ready? Okay. Good morning. Good morning, everyone. My name is State Representative John DeSimone. I'm a Democrat from the city of Providence. I'm here to attend and join in with this press conference to advocate for restoration of the proposed cuts by Governor Chafee, which amount to $375,000 in the next fiscal year to the Rhode Island Foster Parents Association. So with that, I'm going to introduce Lisa Gallant, who's the Executive Director of the Rhode Island Foster Parents Association, and she'll begin to talk about the issues that these cuts would have and the effects they would have on this great organization. So with that, Lisa.
Thank you, Representative DeSimone. Representative DeSimone is my own representative from District 5 in Providence, so I want to give him a round of applause for supporting us today. Thank you so much. I also want to take a moment to recognize Representative Frank Ferri, who's with us also, joining in support. And I want to thank everyone who's here today rising in support of the YESS Aftercare Services Program. For those of you who don't know, YESS stands for Young Adults Establishing Self-Sufficiency. It's a program that serves 232 young people who have aged out of foster care in Rhode Island. And the program provides supplemental supports and assistance as these young people make their successful transition to adulthood. Couple key statistics about the program that you would want to know. In 2010, 108 young people aged out of foster care in Rhode Island, meaning that during their tenure with the foster care system, they were neither reunified with their birth family, nor did they achieve permanency through adoption or guardianship. These young people would, without these supports, would be left with the painful decision of trying to figure out whose couch they could stay on, where they might be able to go, what family member that they've been estranged from might be willing to take them back. It's a heart-wrenching choice for young people, especially at a time when 14% of them are seniors in high school trying to finish up schooling. Many of them are in college or working. And this program provides just a modicum of basic supports to help them get to success in life. In 2011, 129 young people aged out of foster care. So there's an upward trend here. There's been a 19% increase in the number of young people in Rhode Island aging out of foster care. And yet the governor's put forth a proposal that would provide a 19% cut, or $375,000 cut to the program. If this proposal goes through, 46 young people who are participants of this program will lose all of the services. And we will have to institute an immediate wait list for new participants. This would be truly catastrophic and, in my opinion, unconscionable. This morning we're going to hear from Dr. Gregory Fritz. He's a noted psychiatrist and academic director at Bradley Hospital. He's going to speak to us a little bit about new research in adolescent brain and its impact on support of this vulnerable population. Dr. Fritz?
Well, thank you. It's a pleasure to be here this morning and be testifying later in the day on behalf of this important program. I think it comes at a very remarkable time in our culture and in our American society when, in fact, adulthood is, for any young people, adulthood is really being delayed because of the changes in our society, such that people at 18 now are not typically getting married, starting jobs, getting into the independence of raising a family, etc. Instead, there's, because of our increasing technological advances in our society, people are having to spend a lot longer learning the ropes, being in education post-high school for a longer period of time. And things are so much more expensive. It takes time to accrue enough money to start a family, etc. So that young people in general no matter what their situation is, are getting a later start. And the idea that at 18 somebody would be ready to assume all the responsibilities of adulthood is not realistic now. It's based on what was the case after the Second World War, where there were a lot of jobs and in the manufacturing and areas that didn't necessarily require post-secondary education, et cetera. The people were basically relatively easily went out of their families and into adulthood in their late teenage or early 20 years. Well, that's changed, and it's a good thing for us to recognize it. And for kids who've been in foster care, it's even a more important difference to recognize. There's also, in the last 5 years or so, been considerable research done using neuroimaging techniques, the magnetic resonance imaging and other related approaches to understand how our brains develop and change over time from infancy onwards. And what we used to think was that essentially all the development was done by childhood. But with the newer technology, we're able to understand that development of the brain continues well into the mid-20s, such that the adult size and function of the brain is not in place until the early to mid-20s, especially the areas of the brain that are responsible for making decisions, for controlling impulse, and those sorts of things that are required of adults. So the result is that we learn, on one hand, that the brains of young adults, late teenagers and early 20s, are what we would call plastic. They're still able to change and be modified, but the other side of it is that they're certainly not in the mature adult brains. So what we're finding is that more and more young adults are staying with their families. They're moving back into their family homes, et cetera, after college sometimes. And these are for the kids that are the most advantaged and have had the best support and so forth along the way. For kids who haven't been that fortunate, they need and really require the support of our societal laws and funding into the 20s, certainly to age 21. And without that, the truth is the kids who are aging out of foster care run the risk of having a very difficult or unsuccessful transition to adulthood. So I can't think of any better use for our funds from a rational standpoint, given what we know about the development, from an economic standpoint, given the costs of an unsuccessful transition to adulthood. It's a small amount of money, and it's money that we really, really need to keep expending on this important group. So, thank you.
Thank you so much, Dr. Fritz. Certainly the brain research is incredibly compelling in this area. Another thing that's compelling about the program is our young people that we serve. They're amazing, resilient, powerful young people who have done tremendous things while in this program with just a modicum of basic supports. With only $8,200 a year on average per participant, with $5,400 of that going directly into their hands to help pay for rent, utilities, and other supplemental living expenses, these young people have demonstrated a gross increase of over $100 in their wages from the time of entry to their most recent follow-up. They've come into the program saying, 6% of them saying that they had safe and affordable housing, and at their most recent follow-up, 87% of them reported that they felt that level of security. So these are young people that are willing to take the ball and run with it, that they're trying to make a successful future for themselves and move to self-sufficiency. And now it's my pleasure to introduce the interim director of the Rhode Island Council of Resource Providers, our collaborative partner who administers the YESS Aftercare Services program, Kimberly Rose.
Okay. I don't do this a lot. As Lisa had mentioned, I work with the program that administers the YESS. I work with the agency that administers the YESS program. So the young people that are in this room are my heart and soul. So while we have compelling research and we have the statistics and the data that our staff and our agencies have collectively gathered and have asked you endless questions, it's to show how much this program can do for you so that you can do for yourself. But what I'm going to do today is for the other people in the room is to kind of paint a picture of those youth, because data and statistics translate to real people with real lives, with real names, real hopes, real dreams, and real apprehensions and anxieties. As I look around the room collectively, I am seeing young people that have endured incredible, incredible, incredible hardships. They have witnessed domestic violence. I have a sibling group that has witnessed the death of a parent and a sibling. We have young people that have endured traumatic brain injury. We have young people that were either not diagnosed or misdiagnosed that represent the Asperger's and autism spectrum. And while these things sound incredibly defeatist, they are the same young people who are attending college, that are making their way in the world, that are working full-time and part-time jobs, that are building and rebuilding friendships with family members and siblings and coworkers, and meeting new friends and realizing that you can trust people and trust in society again. The 19% cuts that are on the table represent a huge and incredible step backward for 46 young people. And not only those 46 young people that would be immediately eliminated from the program because we can only fund so many, it would also create a waiting list for countless other young people who will be stepping up to their 18th birthday and be told that we'd like to help you, but we just can't because Rhode Island doesn't feel that it's as important as perhaps some other things. I really think that what needs to happen, what has to happen, is those cuts need to be restored, because there's nothing that's important as the young people in this room, because they are what will bring us our future. They are our future, and I know that that sounds cliche, but if you work with them, you realize that that is the absolute truth. So I thank you all today for coming, and I hope that you can support this as we move forward. Thank you. Great, I get to do the fun part. I'd like to call up Ms. Jasmine Alvarez. Jasmine is one of our YESS participants. She is an incredible young woman, and she is going to share with you how she felt YESS has helped her. Thank you.
Whoa. The YESS program has presented me with opportunities that will forever change my life. If it was not for this program, I would not be able to call myself a soon-to-be certified nursing assistant and college student. For the first time in my life, I have a plan to obtain my aspirations and an opportunity to become a successful and independent young woman. The YESS program has assisted me with my biggest aspirations to become an independent young woman in various ways. This program assists me with obtaining health insurance that pays for my seizure testing, enrolled me into the Exeter Job Corps Academy to obtain my certified nursing assistant license, provides me with constant case management supports, and assists me with assessing tuition assistance that grants me the opportunity to not only attend the Community College of Rhode Island, but also the University of Rhode Island. The YESS program has presented me with opportunities that I have never imagined possible. Up until participation in YESS, I have felt lost and I will never amount to much. But now I owe thanks and a successful future to the YESS program. Without the guidance and support it has provided me, I would not be able to say I can finally depend on myself, give back to my community, and be a positive member of society. I started as a young girl lost in her past, and I developed into an inspirational, independent, college-enrolled, self-sufficient young woman, and that's thanks to YESS.
By a show of hands, could we see all of the current YESS participants who happen to be in the room today? And how about alums, proud alums of the program? Thank you for being here today to support this incredible program. And I wanted to provide you with some closing remarks from Representative Ferri and thank all of you for coming and cue up what's going to happen later today. At 1 o'clock, the House Finance Committee will be reviewing DCYF supplemental and fiscal year 2013 budget. We will all be down there to provide testimony. There are many young people in the audience that will be providing both oral and written testimony to fight these cuts and bring to the attention of the House Finance Committee the importance of this critical program. In fact, one of the key data points that we have for the committee is that among the members, the 16 members of our House Finance Committee in Rhode Island, there are 62 YESS participants who reside in their districts. And their supplemental living expenses bring over $335,000 into those districts this year. Those are funds that are going to help support landlords for apartments that might otherwise go unrented. They're funds that are used to help pay for utility bills for these young people and are spent at grocery stores and neighborhood markets. So a $375,000 cut really is not cost effective when we look at the economic impact that this program is having on our state, much less the successful transition that it's helping these young people make. So I'll leave it to Representative Ferri for some closing thoughts. Thank you.
Quickly, I just want to say how fortunate I am to be in this position to help support and advocate along with Representative DeSimone. I wasn't going to say anything, but I was inspired by seeing you here. And just want to, Jasmine, thank you for sharing your story. And Victoria, would you come over here, please? Victoria is in my district, and she left me a message on my phone today. So, you know, I pledge to do what I can to see that we do what we can to make sure we support you. And please, please, don't give up. I've been doing a lot of work in education this year, and I know how important it is for you to continue your education and to go on to a job at a college. And so we need to support you to make sure you do that because, like Kim said, you are our future. And we need you to be as strong as possible. So thank you very much.
Well, I'd just like to, again, thank everyone for coming today. YESS is a very important program. And by being here, we show our support for YESS. And let's hope that we could convince the Finance Committee, which I'm sure they will restore those cuts. And maybe someday we could add to those appropriations because YESS is doing a great job. So thank you again, and thank you for the support. Thank you.